first thing we want to do is get you on the bed so we can go over some exercises. So
Debbie Spina is doing prehab, working with a physical and occupational therapist to get ready for her hip replacement surgery.
Push with your hands and go back.
She's opted for what NYU Langone Medical Center calls same-day hip replacement surgery. Many patients are in and out in just 8 to 10 hours.
One more with your right.
They said, "Is this something that you would want to do?" And I said, "Most definitely." I did not want to stay here any longer than I had to.
They do about 400 hip replacements a year.
Dr. Roy Davidovich is director of NYU Langone's Hip Center.
At this point, it looks like about a third to 40% are going to be going home the same day. That number has been increasing over the years since we've started doing this.
Lean just a little bit forward.
For myself, I'm a firm believer that when you're in a home environment, you tend to do better. The option to go home the same day and have that family around me was something that I wanted to do.
Right, left.
In order for that to happen, surgeons have to rethink a number of factors. The surgical team uses what's called an anterior approach, going through the front of the hip, instead of a posterior approach through the back. The anterior approach results in less muscle damage and quicker initial recovery. Patients are given anti-inflammatory pills before surgery, shorter anesthesia, and a cocktail of medications that helps with the pain and inflammation.
You need an operation that is done efficiently, quickly, as atraumatically as possible.
Studies show patients' long-term outcomes are the same either way, but some surgeons aren't pushing the same-day option.
We perform the most hip replacements at any institution in the United States.
Dr. Douglas Paget is chief of joint replacement at Hospital for Special Surgery in New York.
This is a major medical intervention. Safety is the #1 premium. While I recognize that there's no place like home, should there be the need for urgent or emergent medical care, the question is that will that be available to the patient when they're in the setting of their own home?
Good. All right, turn around.
The people who are against the whole idea of same-day discharge for hip replacement are concerned about the very rare instances where somebody could develop a blood clot or a fracture of some sort. We haven't seen that. The rates of blood clots or pulmonary emboli is exceedingly low.
Have you ever been diagnosed with a blood clot?
Patients are screened carefully to make sure they don't have risk factors like obesity, high blood pressure, or heart disease.
No, okay.
This type of surgery is not a one-size-fits-all, is what you're saying?
It's not a one-size-fits-all. If a patient is identified as high risk or a higher risk, we don't send them home the same day.
But for those who qualify, it's a welcomed option.
Push down.
Patients are happier going home. Nothing beats the comfort of your own home for recovery. And to be quite honest, if the pain is controlled and the patient is healthy and medically completely stable, there's no reason for them to be in the hospital. It really doesn't make sense.
Hi, Debbie. Good to see you.
Debbie had surgery earlier this morning and it lasted about an hour. Around midday, an occupational and physical therapist came to her room.
She was dizzy.
She was able to move a little bit, but she felt dizzy and nauseous, and that lasted throughout the day. So she actually is not going to go home the same day as she planned.
Out of all the patients that we've done, about 100 patients over the last year, 5% stayed overnight. They all went home the next day.
Debbie did go home the next day and is looking forward to a few things when she's fully recovered.
I had walked prior to this 4 miles every morning. I'd like to do that. And I'd like to improve my golf game, if possible.
Hiba Canso, CBS News.
Yes.